Hello, this is Jim Solvay showing how to do a clean catch urine specimen from a Foley catheter inserted patient. First thing you would want to do after you get the doctor's orders to catch a clean catch urine specimen is make sure you go in there with all the supplies. Supplies you'll want is exam gloves, a 10 or 20 cc syringe, empty sterile syringe, a sterile specimen cup, and like a pair of chucks or something, like a clean area, just so you don't make a mess on the patient. And as well as possibly and you'll definitely want some alcohol swabs, and maybe afterwards like a moist towelette just for cleaning if mess does happen. First thing you'll do when you go in there, you'll introduce yourself to the patient as always, get the patient's name and stuff, explain the procedure that you're doing, and why it needs to be done. You'll ensure for patient privacy by closing the door and drawing the curtains. You'll draw up the patient's gown, and you'll put on your exam gloves. And you'll actually want to assess the Foley catheter site first to see if there's any problem with placement or anything, if there's any sign of infection from that end or pain or discharge or anything like that. Then what you want to do is you want to take the liquid that's currently inside this tubing and kind of force it down into the Foley bag there. And then you want to clamp it so no new liquid will flow down it. You'll clamp it. And sorry, I'm doing this with two hands. Hold on. And after you clamp it, you put this like kind of little clamp device on. That will ensure no new urine will go down this device into the Foley bag. That way, any new urine that's collected will be in the upper portion, the proximal portion of the catheter, specifically in this portion right here, which is going to be important. I'll show you why. Remember, this whole time you have exam gloves on. At this time, you'll take an alcohol swab, and you'll take your 10 or 20 cc syringe. You'll take the alcohol swab and you'll clean this port. It'll be this port right here. This port is the balloon port. You don't want to go in there. You want to avoid that one, otherwise you could damage the balloon or the integrity of the catheter. This is the port you want to go in. You'll also need a needle for this. Also, I forgot to mention that as well. Something like maybe a 20 gauge would be fine, or 22 gauge. You'll clean the port with an alcohol swab. You'll insert the needle, and you'll draw up as much urine as possible. If you need to, you could actually press down on the patient's bladder with your non-dominant hand to get some more urine into this area that's proximal from the kinked end. That'll fill up that area with urine, and you could get some more urine that way. And you could draw up about 10 cc's. Really, you only need about 5 cc's, but you could draw up maybe 10 cc's of urine. After you do that, you pull that out. You'll safety cap the needle and throw away the needle in the sharps box correctly, but keep the syringe. Don't set down the syringe because you don't want to risk contamination. You then take the plastic, the specimen bottle. Remember, it's sterile inside, so you have to be very careful when opening it. If possible, like what I just did now is I actually contaminated it with my gloved hand. I touched the side of it, so this side would actually get a new one, because that would possibly interfere with the results of the test. So you want to be careful when opening it. What you can do is you can carefully put the non-sterile side upside down on the table. Then you take your syringe. You take your syringe And without touching the sides of the bottle, you empty your urine into there. Then you could throw this out because there's no more urine in there. You now have your urine specimen and you carefully cap it. Use 2 hands, but I'm doing this with the video camera, so it's kind of different. But you use 2 hands and close it. Make sure it's threaded and make sure it's tight because you don't want leakage, because A, you could lose the specimen, and B, you could contaminate the specimen. Once you do that, you put a patient label on here. You secured it in a specimen bag, and you send it to the lab or to the appropriate people for collection for culture. After you're done with that, if it's ordered, you can go ahead and give antibiotics as ordered. You want to wait until after you collect the specimen before giving antibiotics, because you could have the antibiotics could already have an effect on it, and you could have a mismatched reading from the lab, and they might not be able to give you as good of a result of which antibiotic would work best when treating the infection of the sepsis. Up here, I have pictures here I printed online showing exactly what I spoke of. We have right here the kink that you need to clamp, the gloved hands I told about. Some Foley bags have a lower lock system, some have a needle lock system. The bag I had needed a needle. But yeah, you'll draw up the urine that way. And everything before that, you kind of want to be wary of. You kind of want to avoid everything past this balloon port site, everything proximal to that. Kind of avoid that, because you have to remember that's inside the patient, and the closer you get to that, the closer you risk infection. Over here is just a picture of someone drawing up urine that way. Kind of hard to see. I think that might be a needle. I don't know. But that is how you collect a clean catch urine specimen from a Foley bag. And like I said, you give antibiotics afterwards. Thank you very much.